Breast cancer is the most common cancer in women all over the world, and every year it claims millions of lives, especially in developing nations where access to healthcare and treatment is still low. Medical professionals say early detection is key to defeating breast cancer. Now, this October, which is Breast Cancer Awareness Month, is an opportunity for nations to collectively examine cancer control strategies and to identify winning formulas that will accelerate progress. Joining me via Skype from Abuja is Executive Director, Royal Nursing Consult, Julie Ngmokbo. Julie, good morning, and thank you for joining us on TVC Breakfast.
Good morning, Veronica.
Now, breast cancer awareness means different things to different people. Those living with it, those struggling to fight it, and those who are helping patients live through it, as well as those seeking to eradicate it. When you look at all of this, where are we in trying to ensure that we bring it to the barest minimum?
Okay, thank you very much, Veronica. It's the cancer month, and I am hoping that we will be able to have a situation whereby we actually can reach to more people with the necessary information in order to really eradicate, reduce to the barest minimum what we are experiencing. I think for everyone, it's a collective effort. We need those who are currently suffering this condition, those who are related to them or know them in one form or the other, the stakeholders, the government, everyone needs to be involved in ensuring that we deal with this, because we've had so many cases where people come down with this disease and it affects a whole lot of things. It has a ripple effect on the person's work, on the person's family, on finances, on a lot of things. We do not at all times put together the cost of one falling ill. So if we work together, if we team up, if we form a collaborative team, I think we will be able to do a lot more than what we have done in time past. I'm looking at a situation whereby we take this to the nooks and crannies of the country, of the cities. We don't spare any corner, we don't spare any sector, we don't spare any space whatsoever.
Now, when you look at the aspect of it being said that early detection is key, and you look at the state of a healthcare facility, how much of a challenge is this posing to our ensuring that we bring this to the barest minimum while we look to eradicate breast cancer?
I think the start, I always speak about prevention. If we look at our current healthcare system, we really aren't equipped. The awareness we're talking about also should not exclude the healthcare professionals, because I have been in the system for over 10 years. And before now, when I hear cancer, I hear death, even as a professional. So it's important. I do not blame those that have this ideology. That is because of the current or the situation in which they find themselves. So the healthcare facilities, there's a need for an upgrade on the human resource and the equipment that are needed. May I say that in 2018, we had a conference that had different specialists that are concerned with managing cancer. They came in from all over the world. And my conclusion when leaving that conference was that whoever is coming down with cancer should better have all of the money in the whole world, because our facilities aren't equipped. Our national our insurance doesn't really cover this kind of management. So it poses a threat to our ability to be able to eradicate this, not just the facility, that's on one part. Then let's come to the people. Like I said, it's not just the health professional in time past that would see cancer as death, but the populates, the people themselves, the patient, they don't even want to hear about it. So that's why we need to create an awareness consistently. The October awareness is just to redirect focus, but it's not supposed to stop. All through the year, there's meant to be awareness on early detection, on preventive measures and treatment for people to be able to access care and go for it.
Still talking about awareness, you mentioned earlier that prevention is what you are more interested in, and prevention, they say, is better than cure. Now, what do people need to know, especially while creating awareness and with regards to risk factors that could pose a threat to them as well? Can you hear me, Julie?
Yes, a number of times. Yes, I can hear you.
All right, go ahead.
I have had people ask me 1,000 times over what is the cause of cancer. And I tell them that there is no known cause of cancer. However, there are predisposing factors. So in creating an awareness on the path of achieving prevention, it's important that the people first of all know that cancer is curable if it is detected early. So in order to prevent, when people begin to hear, oh, we can treat cancer, we can cure cancer, they would go on to get an assessment done. We also need to encourage people that, yes, even though you might be scared to get to the hospital, there are other ways through which you can have your assessment done. There's a need for people to mind what they eat. For those who are, that's female, who are below the age of 35 and have been on contraceptives for a very long time, they need to go have themselves checked. For those who are obese, they need to have themselves checked. For those who have history of cancer in their family, they need to go have themselves checked. And for those who have been doing alcohol, they've been taking in excessive alcohol, it's important that they check. And that's even below 35, not to talk of above 35. I think every woman out there should get as much support and encouragement in order for them to go have themselves checked. And that is not even narrow this to breast cancer alone. We have so many cancers. So any kind of illness whatsoever, everyone should go for any form of assessment. Now, I understand the current situation we're facing when we're talking about coronavirus and people don't want to get to the hospital. But there are means. Hospital care or healthcare is being taken to people in their homes. All they need to do is get information. And may I add also very quickly that people used to say that what you do not know will not kill you. But I say this categorically that what you do not know could very well kill you.
Absolutely.
So if you go and seek knowledge, you know, like I usually put it, know the demon you're chasing. So if you know what you're up against, you will know the resources that you can put together in order to fight it.
And that is a good way to end the conversation now. Thank you so much, Julie Mugbo, for your time on the program.